Good afternoon. This is Dr. Matthew Romans. I wanted to spend a little time this afternoon talking about abdominoplasty and the circumstances under which insurance might cover part of the operation. First of all, an abdominoplasty involves removing excess skin and fat from the abdomen. I usually start out with a little bit of liposuction and then make a low incision in the abdomen and elevate the skin and fat up to the umbilicus. Once the skin around the umbilicus is detached with an incision, then I can elevate the skin and fat the rest of the way up to the costal margin of the rib cage. This exposes the abdominal wall muscles, which oftentimes need to be tightened. The reason they need to be tightened is because of prior pregnancies or oftentimes massive weight loss or both. Once sutures are placed in the muscles to tighten them, then I can bend the patient in the middle and take out the extra skin below the umbilical hole and the lower incision. This allows me to pull the upper incision down to the lower incision, and then any skin that gets stretched over the top of the umbilicus, we make a hole and sew the belly button back into place. This leaves a final scar in the lower abdomen and inside the umbilicus. I usually have to close patients over a drain. Now, the circumstances under which some of this might be covered by insurance involves whether or not patients have an overhanging apron of skin that causes them to have hygiene problems and get yeast infections in the lower abdomen. In this circumstance, they need to have records from their doctor that their doctors tried to treat these with antifungal creams and steroid creams. If these records exist, then oftentimes we can get insurance to cover the paniculectomy. The paniculectomy is only part of the abdominoplasty, so only part of the abdominoplasty is covered by insurance. But this does save patients money because it pays some of the costs of the operating room, some of the costs of the anesthesiologist to put patients to sleep for their surgery, and it pays for some of the abdominoplasty. So I hope this clarifies the issues involving abdominoplasty versus paniculectomy and the circumstances under which insurance might cover this. Thank you. Have a good afternoon.